welcome everybody. Hour being 7:30, we will kick off the Board of Health meeting for the 4th of January, 2022. I believe we're already in 2022, but we will start off. So it looks like we have the first thing, obviously a big topic is COVID. Melissa, I think we can impose on you just a quick update of the town. I see numbers going, percentages going way up. So
of course. So we're definitely skyrocketing with our numbers. Our percent for the community last week, so we get the reporting every Wednesday, was close to 10%. So if you've seen kind of from my emails how I show it trending upwards, we're definitely seeing an increase. A lot more testings going on, as you know, with the holidays. A lot more people are getting tested, whether it's a PCR rapid at a healthcare facility or it's at-home testing. As you know, the guidance changed last week, so it kind of has not muddied the waters, but somewhat. So it's just, we've been fielding a lot of questions in the health department regarding what does this mean for us now? Some people were already in their isolation or quarantine period, so they obviously this guidance was affected immediately. So potentially they thought they would be in a certain amount of number of days, and then it got scaled back. A little bit different for the daycare settings, because if you look at the guidelines, it's 5 days for both isolation and quarantine at home, and then 5 days wearing a mask. So obviously that early childcare age group, they can't wear a mask. So they kind of by default revert back to the old guidance where they have to sit out a little bit longer, get tested, and then can return. So again, I feel like it's just constantly pivoting, similar to where we've been multiple times throughout the year. We are seeing, again, the influx in positive cases. They are saying the Omicron virus is very contagious, highly contagious. They are saying the symptoms are less severe. So hopefully that will stand true. Unfortunately, with all the gathering, I think you are going to see cases still pop up for the next few weeks. Again, we are indoors versus outside. So I think transmission rates are higher. We are continuing to promote vaccinations, obviously. We did have the booster clinic in December. We'll definitely look at our availability to potentially hold future clinics, but that's kind of where we're at right now. I think I mentioned on the last call, we were not one of the 102 communities who received the at-home test kit. So we did put that on our voicemail because we did receive a lot of phone calls following the governor's address that week. So it was based off of the federal poverty level. Local did not meet that threshold. That being said, we were recently made aware by the governor's office that there are means to get test kits, at-home test kits for municipalities at a discounted rate. So we are in the works to look into that right now.
Good. Thank you so much. It's definitely hitting people pretty hard. I know most of friends, different text groups, they're all mentioning connections. So everybody stays healthy.
I work in a child care facility, and it's very confusing. We have, children who think they can come in and they can't come in, and parents who go, I have no other place to bring my child except for here, and they threaten the director, and now she has COVID, and it's unfortunately I'm in a position where my role is not. I'm in direct contact with children, but on a limited basis. And so, fortunately, I can, I'm there as full-time 4 days a week, but it's really, the whole situation with staff and parents is very tense, very tense. So.
Well, we got I guess. Okay, so the first thing we have on our agenda, 7:30, is approval of minutes from December 21st. I got a chance to look at the minutes. Were there any comments or changes?
I just had one under the failed septic system, 770 Washington Street, under the motion. The second line, I believe, where it says, per the board's request. Should it be boards? Apostrophe S.
Okay. That makes sense. Okay.
Sounds like multiple boards though.
But the Board of Health's request.
Right.
Okay. Anything else, edits, comments? I didn't find anything.
Nope, not for me.
Okay. Great, then we'll entertain a motion.
Okay, I'll make a motion in regards to the minutes from the December 21, 2021 meeting. The Board of Health approves the minute as amended.
Do we hear a second?
A second.
Great, motion's been made and seconded. Do we hear any discussions or any other comments? And we'll take a vote on the motion. Mona,
Aye.
Carol,
Aye.
and Stefan.
Aye.
I also, 400, the minutes are passed. Next thing on our agenda is 7:35, Planning Board revised site plan approval for 130 West Street and 25 Spring Street. Is there anybody on the line for this item? No, okay.
So this is a revised site plan approval. So it is something that the board has seen before. I know the board vocalized their normal items concerning adequate lighting, sidewalks, bike racks, and making sure that trash and recycling was incorporated in it and that it would not fall under the town collection. So I did make a note on page 3 of the attachment, which you received. It does talk about the 4 bullet points that were brought up by the Board of Health, and they are accommodating all of the requests.
Very good to hear. Anything else on this that is new or changed or anything we should look at in more detail?
No, I think they've covered everything.
So if that was our only comments, it looks like they've been addressed. I don't know if there's any other from the board. Anybody have any other comments or concerns?
No, it seems that all concerns were, were addressed.
Then we will entertain a motion.
I'll make a motion again in regards to the Paragon Investments for the site plan approval, 1 West Street and 25 Spring Street. The Board of Health is pleased that all concerns brought up during the August 10, 2021 meeting were addressed, such as adequate lighting, sidewalks, bike racks, and trash storage. And at this point, the Board of Health has no specific concerns.
I'll second that motion.
Motion has been made and seconded. Any other discussions? Then we will vote. Mona,
Aye.
Carol,
Aye.
Stefan.
Aye.
Also, so 400 on that motion also. Anything else that we have new business, Home for Little Wanderers? Okay, great. I imagine we have some folks on the line for that.
So we do. So we have Rebecca Reed here. Hi, Rebecca. I'll just give like a quick update on the health department side. So we have continued to have positive communication with the Home for Little Wanderers staff. We haven't really had many COVID cases up until really like this week. So, which is understandable. Obviously, it is a school environment. The virus is very highly contagious, so there are going to be cases. I think the main point to drill home is that the Home for Little Wanderers staff is relaying that information to the health department and is also relaying that information to the schools should an individual, have to isolate or quarantine. So those items are being met on our part. We'll definitely have Rebecca, take the stand, and then if the board has any additional questions for either myself or Rebecca, we can definitely answer them.
Thank you. Welcome, Rebecca.
Thanks. How is everybody?
How about you guys? How's everything going?
I mean, like Melissa said, it was poor timing. We haven't had any COVID cases, and I would, since last like Wednesday to now, we've had, a few come up. But it's out there. One of our kids got exposed on a pass and brought it back, and it was the one house that is like been the standalone house that's had no kids get it. They have quarantined for probably close to 3 months total time. And so it's just their turn to kind of go through the house. But the kids are great and kind of hanging out. They think it's nice. They get an extra break from school and, TVs in their room and DVD players in their room. So, they're hanging in there, but, staff aren't getting it, which is great. Knock on wood, it's really kind of stayed contained to the kids, and it's hard because, it's like where they live and in their homes. So the kids don't wear masks. But the staff do. So the kids are kind of passing it to each other, and the staff are not, which is, it's good. And good in that sense. But the second a kid like sneezes, gets a sniffly nose, we're like in your room, we're rapid testing. We're like not going through, we're trying to just shut it down as quickly as we can.
So Rebecca, you do have means to obviously test as needed, correct?
We do. So we do PCR tests once a week for the staff. And once COVID numbers started going up, we started doing the kids also. We would do it when the kids would get exposed either at school or on pass or something, we would test them, but now we're just testing all the kids weekly. And then we were recipients of some of the DESI rapid tests, and then the home actually just purchased 500 rapid tests. So we're going to have 200 of those on site at our program. So we'll do those kind of rapid tests as needed, but we'll continue doing the PCR tests. I will say today I processed more PCR tests than I'd had, in one sitting, since COVID began. So people are coming in on their days off, getting tested. Kids are willingly testing. I think everyone is, it's been around enough that people are taking it seriously and doing what they have to do to stay safe.
How many positive cases today?
Today, none, knock on wood. We had 2 staff test positive over the course of last week, right before the Christmas break. And then we had the kids in the Adams program tested positive on New Year's Eve. So they had not an exciting New Year's Eve. They really had to shut it down and went in their rooms. But that's it so far. We had a couple staff from the school before break. But they had already been out, so it didn't even impact the students on a whole level at the school.
So you following the town's guideline for the 5 days quarantine?
Oh yeah, we are, and we didn't switch when the CDC switched it. We kept the kids who were kind of in their rooms. We kept them in their rooms. We're doing an extra day just to make sure. We're trying to do a little extra to keep everybody as safe as can be. So
that sounds very wise.
Yeah, I don't want it. I got it once and I was so sick. I just don't want it again. So I'm like, make everyone do a couple extra days, a little extra cautious on my end.
Do the kids have separate rooms?
Not all of them. We do. So in our Adams program, there's almost all of them do. There's only one double. And we happen to have a kid who was on pass. And so we kept her on pass so everybody could have their own space. And then the Merrill and Hyler programs, there's only 2 doubles in each one of those buildings. But the Merrill program, we have 2 halls and we have one hall that's empty. So anytime a kid has to quarantine or whatnot, we put them over in the other hall with the staff. It just completely separate them from the other kids. So we are lucky in that sense.
And you do have separate bathrooms for those different halls. So they're completely using a separate restroom facility. Yep.
We have separate everything, like separate, living rooms, all of that. And we're bringing the food to the kids. We have a kitchen that does all the meals for the school kids and preps all the dinners and whatnot. And so they're packaging meals separately for the kids if they're in quarantine or isolation.
And are you guys testing 5 days after exposure? Or because I heard a lot of people the minute they get exposed, they go and get tested, which is not very accurate.
Yeah, so we do both. We'll test them if we found out of an exposure, but then we test them the next week also, because we're testing weekly for all the kids.
Because many people are testing negative if it's less than 5 days. And then on the 5th day, they're testing positive. So I'm like, all these tests before.
Yeah, no, we just did a round of testing for all the kids today, except the ones who have, the positive ones.
Right.
Yeah.
Thank you.
Yeah.
Any other questions from the board? The number of students, any changes in the number of students, any fluctuation, any other changes going on that's different?
No, I mean, not really. We're doing new contracts with DCF. So we'll be shifting and kind of having more boys on campus than girls, but it's the same programming. Our acuity will be a little less. And so our kids will be a little higher functioning and whatnot, but that's really it. There's nothing major going on.
We appreciate you doing us an update on progress.
Yeah.
Did we have on our schedule, Melissa, do we have this as a periodic update?
So this was the last one. So we started it based off of the public hearing that we held last year. So they've been coming forward to us for the last year, every quarter. So I don't know what the board is looking to do. If you want to stop the quarterly updates and then on a need basis have the Home for Little Wanderers report. I do feel like that the relationship is going in, continuing in a positive direction. And Rebecca's been pretty forthcoming with the COVID cases. And ultimately, this went in front of the Board of Health because of neglect on reporting and making it an issue and a concern for the general public as well as the other schools within town. So I don't feel that that's a concern anymore. So I think the public health aspect has been corrected, but ultimately the board would make the decision.
I personally would appreciate the quarterly reporting. I like being able to speak very much in favor of what is happening at the Farmer Longview Farm. I think it's a great facility. Rebecca is wonderful. The time I spent there was very positive. So I like being able to be a positive member of the community and speaking about the facility. So I would like their continued reporting to us on a quarterly basis.
But Rebecca, if you wouldn't mind, maybe just knowing that the cases and how things are changing, would you mind in another quarter? We'll do it
Oh,
again.
absolutely.
That would be awesome. I hate to put you out. I know you've been very patient with us and our requests, so we don't want to push you over the line. But that would be awesome if you wouldn't mind doing that. And then
Please, this isn't what's gonna this isn't gonna be what pushes me over the line. This is stress-free.
Good. Well, exactly. We appreciate you being so open and forthright and reporting. So we'll put that on the agenda for the next quarter. And of course, anything comes up between then and now, we have opportunity to be able to catch up if need be.
All right, sounds great.
Great.
Thank you.
Yeah, thank you.
Appreciate that. Anything else for Rebecca or any other topics?
No, thank you, Rebecca.
All right. Thanks, everyone. Take care.
Thank you.
Thank you.
Anything other business we have? Anything new?
No, we don't have anything else.
This is pretty short.
It is a short one.
Our next meeting is on
The 18th,
18th.
January 18th.
Perfect.
And I did just send an email to the board, which you probably didn't get yet, from Jim Johnson saying that they're encouraging all boards to go back to remote meetings. So it's something that we're already doing. So we'll stick with that. As of now, the governor had the extension for the option to meet remotely until April. I'm not sure if he'll revisit that and extend it further, but right now we're still okay to meet remotely and it's encouraged.
We always do the right thing.
We do. We lead by example.
Great. Well, if there's nothing else that we have, we covered our agenda. Make a motion to close the meeting, 7:49. Do we hear a second?
I'll second that.
Second,
Well, then we'll go ahead and vote. And I'll start with Carol since we got you.
aye.
Mona
Aye.
and Stephanie.
Aye.
I also, so the meeting is closed and we'll see everybody in 2 weeks.
Thank you.
Thank you,
Take care.
everyone.
Thanks
Bye,
so much.
everyone.
Bye now.
Good night.
Good night.